Hello, everyone. I'm Becca, dietitian by trade, mom 24/7, wife from the start, and when there's a few extra hours in the day, you might find me hitting the trails or on horseback.
And I'm Kara, a therapist to women, a mom to a boy, an entrepreneur, mountain junkie, and a postpartum runner.
And this is Fit for a Queen, a podcast that's devoted to the female athlete wanting to balance the teeter-totter of all the things we desire out of life as women: performance, health, intellect, and taking time for self, even if we only get 1 minute out of the day.
We're so excited to be bringing you the queens in the athletic world who have done just that. Okay, ladies, take a seat at your thrones, grab your crowns, and welcome to Fit for a Queen.
All right, welcome back, queens. We have Michelle logging today, and she is a doctorate of physical therapy. Michelle is one of the few eating disorder sensitive informed physical therapists. We have like original OG in the house.
An OG.
Yeah. Mm-hmm. She began her career as an inpatient physical therapist at Denver Health in 2008 and almost immediately began to explore the integration of physical therapy services to individuals admitted to the ACUTE Center for Eating Disorders at Denver Health. It was here that Michelle cultivated her passion to provide excellent physical therapy care to this patient population by coordinating a mobility program and providing individual patient care for approximately 11 years. Sensing the need to cultivate access to physical therapy services and meaningful movement, love that, in the outpatient world, coupled with her desire to expand physical therapy as a recognized profession in the field of eating disorders, Michelle created her private practice, Movement is Medicine, Physical Therapy and Wellness, in January 2019. Here she blends her background as a yoga and fitness instructor with her physical therapy skills for rehabilitation, injury prevention, and education to encourage clients to participate in the movement and healthy reconnection with their body. Michelle has been published in the Journal of Acute Care Physical Therapy and was a contributing text editor for Pathology Implications for the Physical Therapist. She's a member of IADEP, an inconsistent member of the APTA, and a member of the Global Pelvic Health Alliance. She regularly lectures to the physical therapy students at University of Colorado Anschutz. Am I saying that wrong? Anschutz Medical Campus to provide education on eating disorders and the importance of physical therapy care. Recently, she completed training to become a pelvic health physical therapist and completed her certification as a pre- and postnatal coach through Girls Gone Strong.
As a postpartum athlete herself, Michelle recognizes the intersection between dysfunctional exercise, disordered eating, body dysmorphia, and decreased relationship with pelvic health that can be common pre- and postpartum. In her free time, she enjoys learning more about pelvic health and the female athlete, participating in classes at her local gym, hiking 14ers, cycling, and living life with her husband and 2 young kids. Welcome, Michelle.
Thank you. It's so great to be here. Thanks for having me.
You have such a fun background.
No kidding.
And overlap of things that we all love. So we're going to have fun today.
Right. How did you step into this since it really hadn't been created? It's kind of like my buddy Amanda that started as strength coach. Like, it was never created. So there has to have been some sort of... Yeah. Tell us.
Yes, Amanda and I have been talking too, so this is good stuff. So, when I started as an inpatient physical therapist at Denver Health, we had a floor-based model of treating our patients. So I was essentially assigned a certain, floor that I was on, and I would treat those patients on that floor. And it happened to be that the acute unit was blossoming at that time. It was a 2-bed unit back in 2008, I believe it was.
Wow.
And I was kind of following in the footsteps of another colleague of mine who we just started getting PT consults on these patients because they would come in and they weren't able to get out of bed, they weren't able to stand up and walk, kind of those basic things that we kind of take for granted. So I really just kind of walked into it, and it's really funny. I kind of always have the discussion that I didn't necessarily choose this population to work with. This population chose me, and this is now it's become my passion and my mission. So it's been a good thing all around.
Well, perfect. So tell us how you integrate this movement within the eating disorder population or disordered eating using a body positive and health at every size approach?
Yeah, that's great. Great question. So I haven't done any training specifically through Body Positive, but I absolutely love their 8 pillars that they have on their website, talking about acceptance. Everybody can come and do movement. Just having the permission to move your body in whatever way is meaningful for you, and not having to worry about, size, weight, shape, anything like that. And then the health at every size, really kind of a very similar kind of strain in terms of really just showing individuals that they can access movement, and really from an eating disordered eating perspective, working on that dysfunctional exercise piece. And really is trying to understand, what is that balance? What is a good balance? And it's unique to each individual, but what is that balance of bringing movement in? My experience has been when I was working with patients at ACUTE, a lot of times they were told, you can't move, you can't stand, you don't want to burn calories, which I understand that. And that's really how we started out initially at ACUTE, because we didn't know better, right? And now I feel like we know better, and we continue to learn. I mean, I can say it myself. I continue to learn every day, but movement is a very integral piece. Our bodies are made to move. And I feel that through and toward recovery, those of us that are in that place where we can talk about movement, we can talk about how your body responds to exercise and things like that. I think we are an integral piece in the treatment process. Instead of not allowing movement, we need to be able to allow our clients and our patients to literally move through their recovery based on what's unique to them and what works given, what's going on.
Absolutely. I love that. Michelle, I'd like to talk a little bit about spending time talking about the kind of postpartum period. Can you go down the rabbit hole with me for a little bit?
Let's do it.
Yeah, let's do it. First, I work with this population, and there's such angst around getting my body back after delivery. I want to start exercising soon. And it's such a vulnerable time for every woman after delivery, but also those that have struggled with an eating disorder. So first, let's talk about what does safe return to exercises and sport look like in the postpartum period?
That's a great question. And honestly, it's different for everybody. It's based on, how the pregnancy was, how the delivery was, what this particular patient wants to get back to. And when it comes to getting the body back, I feel like we see that a lot in, our social media feed, and we just see it a lot as women. We just see it everywhere. And that's the message that we are kind of bombarded with. And I think in the postpartum area of returning to movement, I think it's such a special time in terms of cultivating that reconnection with the body, because having a baby, that's a big deal. Mm-hmm. And I don't really think that we stop and give it the respect of what it takes out of a woman's body and what a woman's body goes through. I mean, it's a beautiful, beautiful process, but it's a lot for women afterward. At times, it's hard depending on, how the pregnancy was and the delivery, and that it might be hard to actually pick up, it might be hard for a mama to pick up her baby because of weak core muscles or weak pelvic floor muscles. So that is such a beautiful sweet spot for somebody that is well versed in this to be able to create that connection and really change the body talk. I'm going to say, change that perception of, I want to get back to my pre-pregnancy body and things like that. And I really think that through our discussions and through building that rapport with our client, we don't necessarily need to tear that down, because if that is something that is really, really important for our client, we're not going to be able to necessarily change that. But I think it's the education, and that beginning to understand how the body works, and really, coming into one's own and feeling strong within the body again after carrying and birthing a child is so incredibly powerful. I got goosebumps talking about it. It's so incredibly powerful.
Oh, yeah. I think it's such a time of growth and to work on some of the challenges that women have even before becoming pregnant when it comes to body image and the body. Can you talk a little bit about specific tools that you're using to help reconnect with the body and management of potential kind of body dysmorphia?
Yeah, that's great. So I ask a lot of, one of the outcome measures that I like to do with my clients is I do the compulsive exercise test. So I'm answering your question, but I'm kind of going roundabout.
Yeah.
So I do the compulsive exercise test because I really like that, because it gives me a really good insight into how that individual views exercise within their world. But then in terms of working on kind of the body image piece, those sorts of things, I really do it's a lot of dialogue back and forth between my client in terms of, how did that feel? How'd that feel in your body? Where did you feel it? Those sorts of things. And I'm kind of mining for that connection back into the body. And sometimes it's very superficial, oh yeah, that was great. Yeah, that was easy, whatever. And other times, it's well, but where did you feel it? How, did you like that move? Did you get excited about doing that? And I had one particular client, I can't remember the exact move we were doing, but it was all of a sudden she lit up and was oh my gosh, this feels so good. And I'm perfect. Tell me more. Tell me what that's like. Tell me what you're feeling in your body. And I feel that's a really important thing to kind of start to draw out of our clients in terms of, overall, why are we doing this movement? That's a big, umbrella question. But while we're doing the movement, are you really enjoying it? How does this feel in your body? Are you really feeling it in your body, or are you just trying to rep out whatever and be done with it? So those sorts of things. Hopefully I answered your question. I think it kind of went off on a tangent.
No, yeah, you did. I mean, I think, again, physical therapy in the postpartum period, I think women think about the pelvic floor and delivery, but I don't think women understand, well, they do when they get to it, how having a baby takes a toll and how we change our posture so much. I mean, from breastfeeding to feeding, our shoulders are hunched over. We're sitting a lot more because of that. We're hauling around bags and a car seat. It takes a toll.
Pulled a bicep muscle with having the diaper bag on the same side and you carry the infant carrier, and had to start rocking the backpack.
Yeah. I've noticed with my clients, I think this is such an important piece. I mean, this is just a thing for women and mothers, is them taking the time to take care of themselves, to go in, to get these services for their body. I mean, we could get into a big discussion about that, but I know I just need to get them there is the biggest thing.
Yeah. Yeah. I mean, I think I might actually go down that just a little bit. I think it's kind of one of these things as women, we just kind of accept, okay, so I had a baby. I have 6 to 8 weeks off of work, and I need to learn how to be a mama, because I don't, this child didn't come with a tag to tell me how to take care of it. And so I have to figure that out. And then when we go back for our 6-week appointment, it's not standard of care in the United States to be followed up by a pelvic health therapist. And I can speak from my lived experience. I remember asking questions and saying, I really want to get back into exercise. My body feels different. And is that normal? And what should I do about that? And, at the time, I just don't think that just wasn't a discussion. And I'm very, very hopeful. And I do think that things are changing. There's a lot more information out there in regard to how do you safely return to exercise, which I think is great, but our mamas have to look for it.
Yeah. You're right.
So
and that can be an effort to hunt.
I almost wonder too if there's some difficulty with connecting with the body and self, because when you're that new mom, or maybe you have multiple children, you almost lose your identity as self, because it's always go. So it's probably hard to kind of disconnect and forget that you are one. You're one person.
Yeah, I think that's such a great observation. And I agree with you. Like, those things that maybe were really important to us and really like filled our cup before we had our babies, we just kind of put them on the back burner. And, that loss of identity. I think you nailed it right there. The loss of identity, and gained a new one.
Yeah.
Yeah. So from all this, a lot of times, whether it's the dysmorphia or, your body's healing from an eating disorder, there can be actual pain that ends up manifesting, and then that leads to dysfunctional movement patterns. Like we had, a year ago, somebody on that talked about how, like, I had to relearn how to walk from just compensating on my foot, and how I had to practice standing in my kitchen because I didn't even realize I wasn't moving the way that I was supposed to. So tell us how you integrate that with your work with either, the postpartum or the eating disorder client.
Yeah, that's it. That's great. So this might be kind of a silly analogy, but I kind of think of like the physical therapy profession. Now, granted, this is my viewpoint, it's kind of like an onion. And at the core is that treatment of dysfunctional movement patterns. That's what we learn in our doctorate program. And we learn, restoration, maintenance, and promotion of optimal physical function. And that comes directly from the APTA website in terms of defining what physical therapy is. And going further along those lines, we enhance the health, well-being, and quality of life. So it's huge depth and breadth of what we do. But then the different layers that we add on, I kind of see that as what we as physical therapists add on uniquely that fills our cup professionally. So for me, it's learning about eating disorders, disordered eating, dysfunctional exercise, pelvic floor, female athlete, pre and postpartum exercise, those sorts of things. But then in terms of bringing that into treating the patient, it's really about what the goals are for the patient, what they're specifically coming in with, if it's an injury, or there's the injury prevention piece of things. But a lot of it becomes the education. Again, I'm going back to that topic, the education about how the body works. And what I've found with my patients that I've worked with is that just kind of talking about, hey, these are the muscles that you have that are in your pelvic floor. Do you know where the pelvic floor is? Have you heard that term? And it's not meant in a condescending way at all, but just let's get some pictures out and let's learn about our bodies, because I just don't think that there's that connection there. And sometimes those visual images, or even like having a model, just like opens up this I don't know what to call it, but it's this pathway, this welcoming of, oh wow, that's my body, and that's really unique, and my body does that. That's really amazing. I'm not quite sure if I answered your question. I think I kind of went on a different path. So if you need to redirect me, please do.
No, I mean, and that makes a lot of sense. For example, with my work within REDS, I educate them your underfueling impacts your digestion, and that impacts your mood because you need food to make neurotransmitters. And I think either A, it was never taught to them because I had to learn on my own, or B, they just start to separate in I can't think of the word.
I don't know what you're saying. I don't know what you're trying to say.
Compartmentalize. There we go.
Compartmentalize. Yeah, compartmentalize.
That they don't forget this all works together and synchronized. So,
yeah.
I think overall, I want our listeners to kind of just be clear, because this is kind of, I feel, newish in the field. But where do you think physical therapy lays in the recovery of someone with an eating disorder?
Oh, I so love that you asked me that. here's the thing. When I first started as a physical therapist, I felt very alone in terms of like working with this patient population, and really like not a lot of confidence in regard to what I was doing, because there wasn't any literature per se that told me, or evidence, I should say, that essentially prescribed what I do. But I sensed this amazing need for these patients, and the time spent with the patients was, I felt like it was so beneficial for them. So I feel that there is a regular place for physical therapists at the table for the treatment of eating disorders, disordered eating, and dysfunctional exercise. Mm-hmm. I think it's just another specialty that we can talk about the movement, we can talk about the body. Again, it goes back to that education piece, and really helping the client to understand all the beautiful ways that their body works, and then how all the systems work together. Like you were saying, Becca, like this, well, because of this, X, Y, and Z is happening. And, kind of looking at it from a global perspective, because I don't think that that's necessarily what our clients and patients do. Mm-hmm. So I definitely think that there is a place for PT. And I know that there are more PTs out there that are working in this profession, and I want to know them. I want us all to come together.
Yes, because I worked higher level. When I was working higher level care of eating disorder recoveries, it did come to mind that this would be a great, as they discharge, working with a PT after discharge. And I thought it was a great relationship. However, it was very hard to find a PT that'd be willing to work with this population, just, I think, for fear of they didn't know much about it. But also what we did, we had a PT that came in and did a program for our clients, and they actually taught about what our body did and educated the patients in the program about the body, and they really loved it. And I think it helped with just recovery with an eating disorder. But I would love for you to do some training for PTs around eating disorders to just get them more comfortable working with this population. Because you're right. I really think there is a place for it for sure.
Most definitely.
Yes.
Yeah, actually, from working in sports medicine, one of the ideas I had was, they're not going to like hearing this term, but I could get insurance to help cover it if they were diagnosed as deconditioning.
Deconditioning.
Yeah.
So then they could integrate safe movement and start, especially if they were like a college athlete, rather than throwing them back to the wolves. They start with physical therapy.
Yeah.
And then it's about the function, not about like numbers and everything else. So that's because I didn't know there were Michelles out there that, we need to mold Michelles.
Well, goodness, when you bring in insurance, and then that makes it more complicated. You have to have a code.
Yeah, insurance makes it way more complicated.
I don't worry about that stuff, but that is a problem of how, again, we get specific care to people that need specific things. But yes, I love what you're doing, Michelle.
Yeah, and while you're out, tackling all this and creating this new area, how are you living out the FIT philosophy, balancing performance and health and intellect and time for self?
Oh gosh, that's such a great question. I knew you were going to ask me, and I'm like, how am I balancing it?
It's coming.
Honestly, I feel like right now I'm in a really, really good place in terms of, which is odd with this whole COVID stuff going on, right? But I feel like I'm in a really good place balancing, all the school things with my kids, building my private practice, picking up shifts at some of the local hospitals here to do like my inpatient PT stuff. And then the time for myself is really that, going to do a workout, getting on my bike, walking the dog, things like that, just taking those little bits of time. I feel like I'm in a really good place with that, and I've got it balanced, and I'm sure that's going to teeter and one way or the other. But right now I'm in the sweet spot. Loving it. You're going to like that, Becca.
Yeah, you know it.
Spot.
Find it and keep it.
I know, right?
Michelle, thank you so much for coming on today. We'll put all your resources up on the show notes, and any way that we can help push this physical therapy movement within eating disorders, let us know.
Yeah. That's awesome. It's great. It was so great to talk with you gals. I absolutely love listening to your podcast.
Aw, thank you.
Thanks, Michelle.
This is an honor for me, so thank you.
All right. You have a great day, and thanks for being on.
Bye, Queens.
Bye.
Today's episode is brought to you by yours truly. I'm excited to announce the releasing of my book, Finding Your Sweet Spot in Sport, Avoiding Relative Energy Deficit in Sport, also known as RED-S, by optimizing your energy balance. Be sure to follow me on social media or go to my website, www.beccamccombel.com. Bye, Queens.
For additional information on today's topic and guests, follow us on Facebook, Twitter, and Instagram at Fit for a Queen. And
Hashtag Fit for a Queen.
And don't forget to rate us on iTunes. We can't wait for you to join us next time on Fit for a Queen.
Bye, Queens.